Hello everyone, my name is Khan Fidaula. Today our topic to discuss health psychology. What is health psychology? The study of the psychological behaviors, process and health and illness and health cares. It is considered with understanding how psychological, behavioral and culture factor contribute to physical health and illness. Psychological factor can affect health directly. Introduction of health psychology. Health psychology is the application of psychological theory and research to health, illness, and health cares. In health psychological, often referred to as a behavioral medicine and medical psychology. There are two fields involved in health psychology. Include like two subfields. Like behavioral health means focus on prevention of health and illness, health problems and illness, and behavioral medicines focus on treatment. Health psychology is considered with the psychological of a range of health-related behaviors, including nutrition, exercise, health cares, utilization, medical decision making, like psychosocial model. The biopsychosocial model views health and illness behaviors as a product of biological characteristics like such as genes and behavioral factors such as lifestyle, stress, and health beliefs, and social conditions such as culture influence, like family relations and social support. Health psychologists work with healthcare professionals and patients to people's deal with the psychological and emotional aspect of health and illness. Goal of health psychology. There are eight major goals involved in health psychology. First of all, understanding the behavioral and contextual factor of health and illness, and second, preventing illness. Preventing illness, the effect of disease, providing critical analysis of policies, health policies, health policies, conducting research on prevention of the innovation in health problems, improving doctor-patient communications, improving adherence to medical cares, finding treatments to manage the pain. Features of health psychology, like clinical health psychology, public health psychology, community health psychologies, and critical health psychologies. Clinical health psychology like refers to the application of scientific knowledge to clinical questions that arise across the spectrum of healthcare, because it focuses on the prevention and treatment of health health problem. Clinical health psychology as a specialty practice on clinical practice include education's mechanism of behavioral change and psychotherapy. Number six, public health psychology. Public health psychology potential causal link between psychosocial factor and health at the population levels. Health psychology psychologists present research result on the epidemiological finding related to health behaviors to educators, policy makers, and with care and healthcare provided in order to promote public health, investigate for at-risk group. Thirdly, community health psychology. Community health psychology investigate community factors that contribute to health and well-being. Community health psychology and also develop community health psychology levels investigate that are designed to combat disease and promote physical and mental health. Example of community health initiate might to further eliminate and drink from school, diabetes awareness, etc. Like critical health psychology is considered with the power, with the distribution of powers and the impact of powers differentiate on health behaviors healthcare system and health policies. Critical health psychology pursues social justice and the universal's right to go to health for people of all races, genders, ages, and socioeconomic.
Health psychology is an expanding area in the UK, British, across Europe and Australia and New Zealand and in the USA. For many students, this involves taking a health psychology course as part of their psychology degree. A clinical health psychologist has been defined as someone who marries clinical psychology with its focus on the assessment and treatment of individual distress, and the content field on health psychology pillar, and Diderot in 1995. A professional health psychologist is someone who is trying to an acceptable standard in health psychology and works as a health psychologist. Health psychologist draws upon a range of psychological perspectives for its theories. For example, it's uses learning theory with its emphasis on associations and modeling. A separate chapter on methodology has not been included, as there are many comprehensive texts which cover methods in detail. The aim of this book is to illustrate this range of methods and approach to data analysis through the choice of examples described throughout each chapter. Thank you.
Здравствуйте, преподаватель. Today I am here to give some information on the health beliefs. First of all, I would like to conclude what it means by health beliefs. These are the actions individuals take that affect their health. They lead to improve health, such as eating well and being physically active, and action that increases one's risk of disease, such as smoking, excessive alcohol intake, and risky sexual behavior. And some examples of health beliefs or behaviors are smoking, substance that we use, diet, physically active, sleep, risk, sexual activities, healthcare seeking behaviors, and adherence to prescribed medical treatments. 4 health behaviors are there, that are: first one, not to smoke; second one, taking exercise regularly; third one, moderate alcohol intake; fourth one, eating few serves of fruits and vegetables a day. And the next point is why to study the health behaviors. The goal of behavioral and social sciences is to better understanding human behaviors and apply this understanding to improving the quality of the life of the people. Because of so many behaviors have an improved on health, social and behavioral sciences, it is impacted and are an important component of studying individual and the group health. Second point is why to study the human behavior has been it also helps illuminate public health care concepts, therefore can play a critical role in the achieving public health goals. And social and behavioral sciences, public health discipline that focuses on health promotion, illness, prevents and barriers to health behavior changes on both the individual and the health system levels. In year 1990, the Baxter analyzed the definition of health provided over 90,000 British adults in the Health and Lifestyle Survey. She classified the responses into 9 categories, that is, health as not ill, the absence of physical symptom; health despite diseases; health as reserve, the presence of personal resources; health as behavior, the extent of healthy behavior. It was found that there was considerable agreement in the emphasis on behavioral factors as cause of illness. There was, however, limited references to structural or environmental factors, especially among those from working class backgrounds. Gender differences were also found. The women were more likely to define health in terms of personal relationship. Murray and Macmillan 1988 are founded that working class women. The Mactor and Macmillan 1988 also founded that working class women made repeated references to their families when describing the cancer disease. And in year 1991, Stanton, Rogers and Q sought methodology to identify the concept using by a sample of British adult to explain health. She identified 8 different accounts of health and illness. The body as machine account, which consider illness as naturally occurring, and real with biomedicine, considered the main form of treatment. There are also many problems that the concept of health locus and control. If health locus of control a fixed state or a transit state, if it is possible to the both external and internal, going to the doctor could be seen as external. The doctor is a powerful other, and internal, I am looking for my health. Health and health behaviors are determined by the influence at multiple levels, including personal, and that is biological and psychological factors, organizational, institutional, environmental, that are both social and physical, policies level. Historically level, many health fields have focused on the individual level health determinants and the interventions. Health behaviors are sometimes called as health-related behaviors, are action taken by individuals that affect health or mortality. These actions may be intentional or unintentional and can promote or detract from the health of the actor, or other actions that can be classified as health behavior are many. Examples including smoking, use of many substances which causes damage of the body, diet, physical activities, exercises which we have to take daily, health.
Здравствуйте, меня зовут Майн Sheikh. Today's my topic is social cognitive models and health behavior. This one is characterized by first, these models do not enable the generation of hypotheses because their constructs are unspecified, that therefore cannot be tested. Second, they focus on analytic truths rather than synthetic ones, and the conclusion results from their application are often to by definition rather than by observation. And then the ones of the main criticism of social cognitive theory is that it is not a ununified theory, that the different aspects of the theory do not tie together to create a cohesive explanation of behavior. Another limitation is that not all social learning can be directly observed. There is a little systematic operational guidance about how best to develop complex interventions to reduce the gap between practical and evidence. This article is one of the series of articles documenting the development and use of the theoretical domains framework TDF to advance the science of implementation research. Methods like the modifiable barriers and enhance the enables, and how can behavior change be measured and understood. Results: a complex implementation intervention was designed that aimed to improve acute low back pain management in primary care. We use the TDF to identify the barriers and enablers to the uptake of the evidence into a practice and to guide the choice of intervention components. These components were then combined into a cohesive interventions. The inner interventions cohesive is delivered via two facilitated interventions, small group workshops. We also produce a DVD to distribute to all the participants.
Hello, my name is Shafil Sheikh. I will talk about the chapter illness cognition. What is the mean to be healthy? Health, according to the World Health Organization, is a state of complete physical and mental and social well-being, and not merely the absence of disease and infirmity. A variety of definitions have been used for different purposes over time. Health can be promoted by encouraging healthful activities such as regular physical exercise and adequate sleep, and by reducing or avoiding unhealthy full activities or situations such as smoking or excessive stress. Some factors affecting health are due to individual choices, such as whether to engage in a high risk behavior, while others are due to structural causes, such as whether the society is arranged in a way that makes it easier or harder for people to get necessary healthcare services. Still, other factors are behind both the individuals and the group choices. The next topic is what does it mean to be ill? Someone who is ill is suffering from a disease or a health problem. In November 1941, Paine was seriously ill with pneumonia, synonyms unwell, sick, poorly informed, diseases, more synonyms of ill, countable noun, difficulties and problems are sometimes referred to as life. Next topic is what are illness cognitions. There are so many factors like identify stigmatization negatively affecting self-perception, cause somebody has done some things wrong, control, varying effectiveness of treatment, powerlessness, timeline, unknown possible recurrences, consciousness, distributed sex, love, and social life, psychological distress. This is the cognitive model of illness, genital warts. Thank you for watching.